Welcome to our and OSCE learning sessions. Today we will go through an overview of Station 6, focusing on clinical skills. Always read the scenario carefully, as they may introduce minor changes in the recommendations. Do not expect the same instructions to remain unchanged for a long time. Usually, only small variation will appear and those are acceptable. And if needed, clearly verbalize each required steps and also maintain proper aseptic technique. These are the 5 moments of hand hygiene. You have to go through these 5 moments accordingly. Before doing any procedure, you have to follow hand hygiene practice. After doing a procedure or touching with a body fluid, you have to do this hand hygiene practice. And don't forget to do the hand hygiene before touching a patient and after touching a patient as well. And in addition to that, after touching any patient surroundings, you have to follow the hand hygiene techniques. In this station, these are the key points to be remembered. As they are provided with the mannequin, they already mentioned that consent has already obtained. Vitals are assessed, pain reported and given the medication as well. Since it's a mannequin, communication is minimal, but it's still better to verbalize actions. For example, while performing initial hand hygiene, you can say, "I'm back for the dressing. How are you feeling now?" And next, promptly clean and prepare the trolley first. Arrange the articles after checking the expiry dates. Once everything is set in the lower compartment, perform hand hygiene again and approach the patient. Start by removing the old dressing. Expect some variations in the condition of the pad. Either it could be clean, soaked with pus, or stained with blood. Verbalize your observation while removing it. The wound assessment may reveal different types of incision, whether it is transverse, horizontal, subcostal, and may be closed with staples or sutures. Count and mention the numbers of sutures and describe the wound length as well. The wound could be clean and healing or show signs of infection and any kind of wound dehiscence if noted. Comment on the appearance of the surrounding skin. After touching the wound, perform the hand hygiene again. And you have to verbalize the clinical impression as well. After touching the wound, perform the hand hygiene again and next open the dressing set in an aseptic way. Just before dressing, repeat the hand hygiene. Don't forget to do that. After touching the wound, perform hand hygiene again. Next, open the dressing set aseptically. Just before dressing, repeat the hand hygiene again. If sterile gloves are assumed, make sure to verbalize, "I am removing the inner gloves and wearing sterile ones." Continue verbalizing each step during the dressing. Declare which hand is sterile and which is for patient contact. Using soft cotton balls, clean the wound directly over the wound top to bottom. Next is farther side top to bottom. Moving further, the nearest side top to bottom. Repeat the same sequence with dry cotton balls. Then place a new pad and cover the wound without delay. And dispose all the used items in the yellow bin placed at the right foot end. Finally, perform hand hygiene again and ask if the patient has any pain or discomfort. Time management, adherence to aseptic technique, and verbalizing your actions are crucial in this station. Continuous practice is the key. Always read the scenario carefully as minor changes are common nowadays.